Hi there, professors. This is Kylie, Jane, Sunday, and Mallory from the Lodi PM clinical group here to present on meningitis. Let's get started. So, what is meningitis? Meningitis is a rare infection that affects the delicate membranes called meninges that cover the brain and spinal cord. There are several causes, including bacteria, virus, fungus, parasite, amoeba, or in a non-infectious mean. Bacteria is one of the most common causes of meningitis. It is spread through contact from an infected person to another. The bacteria enters through the nose, ears, or throat and travels to the brain. The most common bacteria known to cause meningitis are Streptococcus pneumoniae, Group B Streptococcus, Neisseria meningitidis, Haemophilus influenzae, and Listeria monocytogenes. Bacterial meningitis is very serious. The infection can lead to brain damage, hearing problems, or learning disabilities without prompt treatment. In serious cases, it can lead to death. Your body can also have an extreme response to the bacteria that causes meningitis called sepsis. Viral meningitis is the most common form of meningitis. It is usually less severe than bacterial, and most people get better on their own without treatment. However, since some forms of meningitis can be very serious, anyone exhibiting signs and symptoms should see a doctor right away. Only a doctor can diagnose meningitis and determine what is causing it and the best treatment course. Non-polio enteroviruses, the same virus known to cause the common cold, are the most common cause of viral meningitis. Viruses are easily spread from person to person through close contact, but fortunately, only a small number of people infected with one of the leading causes of viral meningitis will actually develop the infection. Meningitis caused by a fungus, parasite, or amoeba is incredibly rare, especially in the United States. Fungal meningitis is caused by breathing in spores that live in places like soil, decaying wood, or bird or bat droppings. Parasitic meningitis is caused by eating an infected animal or contaminated food. Amoebic meningitis is caused by the amoeba entering the body through the nose, usually while swimming. The amoeba, Naegleria fowler, grows in warm, fresh water, such as found in Texas or Florida. There are also non-infectious causes of meningitis. Carcinomatous meningitis is a serious problem that may occur in cancer, where cancer cells spread to the meninges. It can happen in many cancers, but is most common in melanoma, breast, lung, and gastrointestinal cancer. NSAIDs account for most cases of drug-induced aseptic meningitis, with antibiotics, intravenous immunoglobulins, and OKT3 antibodies being other known causes. It can also be caused by lupus, head injury, or brain surgery.
Who's at risk? Children under 5 years old, teens and young adults ages 16 to 25, especially college students living in dorms, and adults over 55. Anyone can get meningitis. Some people are more susceptible to meningitis than others. Those at high risk for meningitis include weak immune system, like people who has HIV. Also those taking immunosuppressant, people who smoke or exposed to secondhand smoke. Those excessive drinkers in any activities can weaken immune system. Post-op patients, especially the removal of the spleen, puts you at high risk for meningitis. because the spleen is the most important part of the immune system. Though it's rare, pregnant women can be prone to developing meningitis associated with an infection called listeriosis in the last trimester. This puts the mother and the child at risk of miscarriage, premature delivery, and stillbirth. If you are in close contact with someone who has meningitis, you are at risk of getting it as well. If you share utensils, cigarettes, or anything on which someone else's oral or respiratory secretion might lurk, you are at risk. College students, especially those who live in dorms, are particularly prone to getting meningitis. Meningitis is transmitted to people by many methods. Both bacterial and viral meningitis are spread person to person similarly. Person to person spread can happen with direct and indirect contact between individuals. Droplets, contact with feces, sneezing, saliva, kissing, or eating contaminated food. Indirect spread by using the same utensils, cups, and other items used by an infected individual can also spread the disease to others. Some fungal infections are transmitted by airborne dust particles. In addition, other types of meningitis can also be transferred to humans by vectors such as mosquitoes and ticks.
Signs and symptoms of meningitis: sudden high fever, a stiff neck, a severe headache that's different from normal, a headache with nausea and or vomiting, confusion, seizures, sleepiness or difficulty waking, sensitivity to light, no appetite or thirst, or a skin rash, which is sometimes called the meningococcal meningitis rash. So this here is a picture of what a meningococcal rash would look like. It's not easy to spot the symptoms of meningitis. People often confuse the early signs and symptoms of meningitis with the flu. In fact, meningitis may come on the heels of a flu-like illness or infection. That's why it's important to stay alert, learn the hallmark signs and symptoms of meningitis, and act quickly. It may save a life. So the treatment for meningitis is antibiotics. It is important that treatment starts as soon as possible. If a doctor suspects meningococcal disease, they will give the patient antibiotics right away. Antibiotics will help reduce the risk of dying. Depending on how serious the infection is, people with meningococcal disease may need other treatments, including breathing support, medications to treat low blood pressure, surgery to remove dead tissue, wound care for parts of the body with damaged skin. The picture here is how they diagnose meningitis, and it's a picture of them doing a spinal tap. So for a definitive diagnosis of meningitis, you will need a spinal tap to collect the cerebrospinal fluid. The inflammation associated with meningitis is most often caused by an infection of the spinal fluid, which surrounds your brain and spinal cord.
To prevent meningitis, you should wash your hands. You should always wash your hands thoroughly, and that is proper hand washing, which is scrubbing for at least 20 seconds. Also, practice good hygiene. Just don't share drinks, food, straws, also lip balms, toothbrushes with any other people to prevent the spread of any germs. Teach children not to share these things also. Try to avoid using hands to cover your mouth and nose, and if you do, you should always wash your hands right after to prevent the spread of any germs, not just meningitis, but any kind of bacteria. you should use the inside of your arm instead of using your hands. Immunizations can also prevent meningitis. These are all recommended. They are not mandatory. The first two that I have listed are recommended schedule vaccines given routinely in the United States. They start at age 2 months and above. The HIV vaccine is recommended for some adults that have sickle cell disease, AIDS, or those that don't have a spleen. The CDC recommends the PPSV23 vaccine for all adults older than 65, younger adults, and children age 2 and older who have weakened immune systems or chronic illnesses such as heart disease, diabetes, sickle cell anemia, and anyone who doesn't have a spleen. These are for children and adults needing protection from pneumococcal bacteria. The last vaccine that I have listed is recommended by the CDC as a single dose at ages 11 to 12 and a booster shot at age 16. Some resources for meningitis. I put resources for patients, which would be the National Meningitis Association with the link. There's a lot of good information there for people that want to know about symptoms or anything like that. Or if they have it, there's ways that, like the Meningitis Now, they can go on there. There's a helpline they can go onto and call and actually speak to a nurse, and they can get feedback from a helpline. And then I also put resources for health professionals, which would, of course, be the CDC. And I put the link for that. And I found Meningitis Research Foundation. That is also really good for physicians to go onto and learn more about meningitis and the different kinds and everything like that. It's a lot of good information for the patient and also the health professional. And then I also lastly just put that World Meningitis Day was April 24th. I didn't know that, so I figured that we could just throw that in there. Thank you.